Thank you, Eddie, for the kind invitation. I'm so honored and thrilled to be here today. Serving as the chair of the Scientific Advisory Council has been so rewarding. And one of the really exciting things that we've been working on together is developing a systemic framework of social connection. And I am so excited to be here today with Carla Perissinotto, who is part of our Scientific Advisory Council. And we're going to talk about our framework.
Great. Julianne, I have to tell everyone too, just a little side note, that I feel really excited and lucky to be doing this with you, and excited that I actually got to see you in person this weekend after a long time apart. But we will not get into talk about that, but I am hoping that you can actually start by, can you walk us through why do we even need a systemic framework, and what does this really mean for this field and for all of us living in this world?
Yeah, I think it's important to set that stage and why it's even needed in the first place. Because as you know, we've both been studying this topic for our entire careers. And we know that there is robust evidence that suggests that various forms of lacking social connection has significant negative effects, including poor emotional well-being, poor cognitive functioning, poor health, and greater risk for premature mortality from all causes. We also have evidence that there is, in essence, a dose-response effect, meaning that for every increase in social connection, there's a decrease in risk. And so what this suggests is that this is relevant for all of us. And that this evidence has been found across the lifespan. So we know that when we lack social connection, there are significant human costs. But there's also costs to society too, including economic costs. And so certainly the global pandemic has shown us how social contact is relevant to almost every aspect of our lives. And yet we know less about what we can do about it. And so despite this wealth of evidence, it's quite noteworthy that social connection is not adequately recognized or prioritized in many national public health efforts. And so given this, this current chasm between our evidence base and our knowledge of this with the application of this, a systemic framework of cross-sector action is needed to guide further scientific investigation, further interventions, practice, and policy on promoting social connection and health.
Great. So I couldn't agree with you more, Julianne. There is clearly, the pandemic has shown us that this is not something that we can continue to ignore. But tell me a little bit more. Can you actually walk us through what it actually looks like? I know that there have been some models before, and I think you'll talk a little bit and walk us through the socio-ecological model, but tell me a little bit more about, like, what does this actually look like in practice, and how do we actually put this into effect?
Absolutely. Okay, so let me share my screen because I think a visual will help.
Great.
So of course, there are these existing models out there that many of us are familiar with. So for example, the socio-ecological model has been used quite broadly in public health. And we also know that the World Health Organization has also developed a health and all policy framework, which the CDC has also adopted, which identifies sectors in which can have an impact on health. And so this includes the health sector, transportation, housing, et cetera. And so one of the things that we wanted to do was, we didn't want to necessarily start from scratch, but we knew that there might be opportunities to build on these existing models in a way that can guide our work further. And so conceptually speaking, we wanted to first start out with, humans and the individual, the person at the center. And similar to the socio-ecological model, we know that individuals are embedded or nested within interpersonal relationships, within communities, within organizations, and within society. And so, of course, we need to think about the extent to which each of these might contribute to our health and well-being, and be opportunities for levers for action as well. And so then, drawing upon the World Health Organization's Health in All Policy framework, we also can recognize that across each of these sectors, there are opportunities for both influence on health and well-being, as well as opportunities for modification and action. But we also recognize that there are some important factors that go beyond these. And that includes the recognition that being socially connected is important across our lifespan, just as almost every aspect of lifestyle that influences health has impacts across the lifespan. And so trying to understand as well as create solutions, we also need to take lifespan approach. We also need to acknowledge the diversity of experiences and have an eye for equity as we consider these issues as well. And embedded across all of this, we need to be thinking about not only what is the evidence, but how do we apply that evidence? And so this really is a way of applying that conceptually. And so really, if you look across these two axes, this axis represents the socio-ecological model and how there are levels of influence at the individual level, the interpersonal level, institutional or organizational level, community level, and societal level. And this sector represents, or this axis represents the different sectors that are included in the Health in All Policy model. And so each cell here then represents the intersection between these levels of influence and sectors. And so this provides almost a map for us to think about how we can approach the types of solutions and approaches that we develop to not only recognize where these might be existing, but also where there are gaps. And that within any particular cell, that we can also think about those overarching examples across those. So I'll go ahead and stop my share there for and really just kind of emphasize that this framework was designed to function as a guide to systematically advance the evidence, practice, and policy relevant to public health. And so the primary strength of this model is that it can help us identify gaps and untapped opportunities so that we can target and accelerate progress in this area. So you in your work, you have many roles. You are a clinician who sees patients, but you also do research and you work with organizations that help implement the evidence. So to kind of bring this to light, I'm wondering if you can, within the health sector, can you walk us through how this framework might be used across levels?
Yeah, thanks, Julianne. And I may ask you to pull back up the model in a couple minutes here. But, I think something that's really important about this is that for some of us looking at this, it may seem like common sense. Like, of course, we're going to work in a socio-ecological model, or of course, we're going to work across sectors. But unfortunately, in reality, that's not always the case. I think about my training as an anthropologist and why and how I got to medicine. And really, for me, it was because I recognized that if I'm going to work on the health of an individual, I need to recognize that they are a part of the socio-ecological model. And that was something, and has been something so central to my training and my practice as a clinician, and how I view this, this topic of social connection. So that's so critical. But what happens, I think, in healthcare environments, and that it either is a product of how we're trained or how our organizations are set up. And so as a clinician, I'm often really just focusing on the individual and really what you would call that first box one, which is the individual and health intersecting. But if I forget to include the other levels, then that is an area where I am not actually impacting someone's health to the best of their abilities, or to the best of my abilities. And similarly, when I am talking about social connection, thanks for bringing up the model. If I'm talking about social connection, if I'm only realizing or seeing this at the individual level, I am again missing an opportunity to impact more, to better impact that person's health, and or to expand those benefits to the whole community. So I think the reason why this is helpful is that either as a clinician, as a clinical leader, or as a community member, if I don't do this in a structured and systematic way, I will miss areas. So to give you an example, you mentioned the lifespan. So I work with older adults, and I work with adults with serious illness. There is a lifespan approach there. And what that means is that I have to be aware that when I am working with an older adult who is 80 and perhaps with some disabilities, and I don't realize that life trajectory, the solutions I may encounter in those different levels will not be accurate unless I take into account the lifespan approach. So what do I mean? I'm working with an 80-year-old individual, but interpersonally, I need to understand something about what is going on with their interpersonal structure. Are they married? Are they partnered? Have they had losses of spouses? That ultimately will impact their connections. And at an institutional level, it also means that we have to understand how we support that person. When I'm thinking about this person's health also, if I don't recognize that there are potentials for interventions or improvements at the community level, I am also missing an opportunity. And lastly, I think a great point at a societal level, and particularly with the lifespan perspective, we unfortunately still live in a very ageist society, and which is why I think that this column, the society level, is incredibly important, because the ageism really impacts how we view social connection and their importance across all factors. So what happens at an institutional level? So I think one of the things that happens when I look at health, like say box 1-3 at an institutional level, if I'm only looking at what happens within the walls of my hospital or healthcare system, that may be one area of evidence, but I am missing the evidence. Thank you. I'm missing the evidence of, are there other ways to impact health at a community level? So this means that means looking at what is going on in my community. Are there organizations and programs that can support my patients or people in my community? And or are there opportunities to improve the evidence? So this is one of the areas where we know there are so many amazing organizations across our country, but this is probably one of the areas where we need the greatest evidence. So we know these programs exist, but do they know they work? So this helps us to see what is going on and what, where is there evidence? Is there an opportunity for improvement? I will also say that, so that's kind of going across what do you call this? Across the levels this way, horizontally.
Yeah, across the socio-ecological model within the sector of health, right?
Thank you,
Yeah.
exactly. But if I also drop down, if I also think about things in a different level, let's say I'm still sticking at the individual level in that patient-doctor relationship, I also have to think about what are the other things that are affecting my patient's ability to stay socially connected. So transportation, housing, these are things that perhaps as a clinician, I would hope you ask about this, but we haven't unfortunately developed systemic ways of tracking this, but I need to be aware of what are the other sectors that are actually affecting individual patients. So is there public transportation, or does the person drive? Housing, not just in terms of where housing is, but how is it built, which also gets into the built environment in number 6. We know that nutrition is a really interesting thing as it relates to health in individuals, but we also know of emerging programs nationally that are trying to mix nutrition and social connection as a way to impact well-being. So leisure and arts, perhaps something that AI may not think about routinely, but there are ways that may be impacting someone's health and well-being individually, but also by inviting connections with other people. This is just a very small introduction and way to think about it, but I think what this helps me do is, when I am either sitting with my clinician hat on and realizing, okay, I'm going to talk about this person's hypertension and blah, 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 but I also want to talk about their connection, and going through these different sectors and parts of the socio-ecological model to really get a comprehensive view rather than just saying socially connected, yes or no, but looking at it comprehensively. When I then put my hat on as a clinical leader, I have to take an even broader approach and not really just look at the individual, but really how is social connection impacting the health of population. So with that example, for example, I am a first-generation American. I am English is my second language, and I understand that the cultural roots of my parents are very different, and therefore what may be available to my parents or people from immigrant groups, for example, to name one group, may be different, may be very different. So I need to be aware of that from a structural and organizational standpoint to really make sure I'm meeting the needs of our patients and understanding where we have gaps.
Thank you so much, because I think that really helps really identify not only how this is so relevant to patients and across the health sector, but really illustrates how important that is across these other sectors and how other sectors can interact and partner with other sectors to better understand the issue, as well as to create novel kinds of solutions. Mm-hmm. And so, how do you think that this framework can really be a call to action to even those outside of the healthcare sector? Because you and I we've worked a lot within this health framework, but some of these other areas are wide open and show huge opportunities.
Mm-hmm. Well, I would say, I think it starts with having us be using a common language. So this allows us to be speaking in the same terminology and making sure, again, that we're aligning with mission, with vision, with the topics. I think some of the sectors are going to be a little bit easier, and it may be easier to come up with ideas up front, and some may take a little bit more time, but there's a huge opportunity. I think probably unfortunately, since the pandemic is still top of mind, work and education are probably, the biggest sectors that I see working along this space. So from an educational perspective, we think about, yes, at the individual level, what is the individual, I would say even, I'm going to make this personal right now is, what is happening. I have a 14-month-old daughter who just started daycare. I'll call that education, but that's at the individual level. But part of this also then involves and moves into interpersonal relationships. So partly why she's in daycare, she needs socialization. If I didn't, I'm doing this research, it would be wrong for me to think that she doesn't need socialization. And I'm starting from the front, from the beginning, knowing that I can't continue to keep her siloed, that she needs to meet other people. But then a part of that is also what's the institutional role? So how does the institution really, which is maybe who's governing my daycare, view the importance of social connection? And unfortunately, right now, how do you keep people safe with COVID, but balance the social connection? So those are all the policies and procedures in terms of what does it mean to still be able to see in person? When can you not be in person? Recognizing that social connection is the overtone. And then the community. Sorry, Julianne, you were going to say
I was just going to jump in and just say, I think your example with your daughter in daycare to my kids who are in high school and now a freshman in college also shows that, again, that lifespan approach and how that can be illustrated across these cells as well. Go on, Carla.
No, that's so great. And I think, from the community perspective, like what is our daycare doing is recognizing we are a community of many different people joining into this daycare, different parents with different professional lives, different cultural and linguistic heritages. Love that my preschool, I was able to tell them, hey, we're trying to raise our daughter bilingually so she can have connections with our family, our Spanish speaking family in Mexico. And they say, hey, we have a Spanish speaking teacher. We will, promote that relationship. That is amazing. And then how is that part of that greater society, which is also, the society and community, I think in this place is a little bit of a intersection of like, we happen to be living in a community right now where COVID rates are lower. And so, the conversation may be different here than in other parts of the country. But so there's this whole way of how you look at it, across the socio-ecological model, and really at the center, keeping like, how do we make sure that our children are getting educated and maintaining social connections? I'll stop there, but I think that there's a range. Yeah. There's a range of ways to look at this that provides some framework for how it works. And then you get into what opportunities are there for growth and improvement.
One of the things that I appreciate about what you just said is how this has also become so top of mind during the pandemic, as there seem to be in some ways competing demands in a way of keeping people safe, but also connected. Mm-hmm. And how do we manage that in a way that promotes public health, because that's ultimately our goal, right? And I think that really also illustrates the pandemic, because in an effort to keep people safe, have implemented various practices and policies that are meant to reduce social contact, to reduce the spread of the virus, that we've seen how this has affected every aspect of life. Mm-hmm. And because of that, the one thing that I think is highlighted is just how relevant social contact is to every sector. And so, these policies and practices across these sectors that we've seen have had an impact on reducing social contact, conversely can have an opportunity to play a role in connecting us more socially. And so this is a huge opportunity for us to really systematically evaluate policy across these sectors. And so I am just really, I guess, to wrap up, thrilled that we have been working together, and I hope to that our Scientific Advisory Council can partner with organizations across these levels and across sectors to really facilitate ways in which we can start filling in these gaps, to start tackling and accelerating the progress across all of these cells. So thank you, Carla, for your wonderful insight into this. And I look forward to many opportunities to collaborate and work together with others as well.
Likewise, Julianne, and I think just to echo what you said, I think it's just, you know, this is a reminder of how we can't continue to work in silos, and despite differences, there is such a great opportunity for us to continue to collaborate. And what a wake-up call, unfortunately, with this pandemic, but what an opportunity to have us really, really focus on what matters to all of us. And, you know, without, you know, sounding too like sappy, is, you know, what a great opportunity to work together and collaboratively. So thank you.